Okay, so I'm pretty much going to show you guys how to use Platinum ED, which is what the school uses to document all of your clinicals, all of your labs, and to do testing on. So when you first sign on to Platinum ED, your screen will look like this. You'll have the option to come down here and create student account, which is what you guys will want to do. When you get in here, you will obviously put your email in, confirm your email, password, all that good stuff, and you will have a course code and it'll be provided to you by your instructor. Once you do that, you're going to create your student account. After you create your student account, you will be able to sign in just like normal. And once you sign in, this is what your screen will look like. You will get this message every single time you log on. Your account will look pretty much just like this. You'll have your EMS testing side and you'll have your Platinum Planner side. When you are wanting to document a clinical, you're going to come into the Platinum Planner side. It'll say West Georgia Technical College EMS and student EMT or student AEMT. Once you're in there, you'll have all these tabs at the top. It'll say home, calendar, classes, labs, opportunities. This is what your clinicals are. Your clinicals are called opportunities. So once you go under the opportunities tab, you'll have a screen that looks exactly like this, and you'll have the option to create an opportunity, find new opportunities, which you will never use this tab. But what you're going to use is the Create Opportunity tab. And when you go to create an opportunity, you will obviously click Create Opportunity and it'll show up as a student-generated opportunity. Your description, say you had a clinical with West Georgia Ambulance Service. It was a 12-hour shift and it was just for a regular clinical ride. This is not your capstone rides or your leadership rides. This is just a regular clinical. So we're going to say West Georgia Ambulance, 46 12-hour shift. So you'll come down here. These will be all of your options. So when you're doing clinicals, you'll have the option to choose, clinical field experience class. These are regular clinicals. Nothing fancy, just your regular old clinicals. You'll go down to your site. So like I said, we did West Georgia. So we're going to go with West Georgia Ambulance Service. And as you can see, all of the services that we partner with are in here. You'll click your start time and your end time, however long your shift is. Your category is going to be emergency room, emergency department, EMS field experience, pediatrics, clinic, whatever you happen to be doing. But like I said, we're at West Georgia Ambulance today, so this is going to be an EMS field experience. Once you do that, your location is always going to be primary, and your preceptor is going to be whoever you end up with. So I'm just going to choose myself as my own preceptor for right now. And you'll submit it. Once you submit your opportunity, it'll pull it up for you. It'll show you over here everything that you just inputted. So like I have the scheduled start, the scheduled end, what category it was, which is EMS field experience. This is a regular clinical, and my preceptor is myself for right now. So when you are starting to scroll down, you can look on the side here and see these tabs. Right here, we are currently in Overview, which is this first tab. Overview has where your clinical is, and it'll even show it to you on the map. Like our main station is the one that's at Linda Lane and 27. So this is 41, but we're at 46. It doesn't matter. After that, you'll go down to Information. This is where your preceptor will be. In the event that you show up to a clinical and you go through your preceptors and you're looking and you're like, oh, my preceptor's not on here. Say your preceptor is a new hire at whatever service or whatever hospital you're going to. You will look right here and see where it says New. You will click New, and you'll be able to input their first and last name. and their email address. This is going to be how you create a new preceptor. When you put this information in, it'll send it to the instructor side, and we will be able to approve your preceptor so that you can submit your clinical. So after this, you'll have, this is under shift details. Like I said, if you cannot find your preceptor, you're going to click on new. Attendance is located over here. This is not something that you really need to do. You're not going to be taking breaks if you're on the ambulance. You're just going to be there for your 12-hour shift. And the attendance part, we will, if we find out that you didn't attend a clinical or what have you, we can come in here and mark your attendance as absent, but show that you still attempted to attend the shift. So once you move on from the information tab, this is when you can start inputting your patients. So the patients tab is going to look like this. Obviously it says you do not have any patients. Click the add button to add a new patient. So we'll do just that. You'll add a patient. This is going to be just like any other PCR form that you've ever used. If you're familiar with it, you can click your contact type, ALS, BLS, pretty self-explanatory, chief complaint, whatever the chief complaint was, gender, their age, and this is where you're going to type your narrative. The thing about Platinum is you will end up typing 2 narratives every time you submit a patient. So the first narrative will go in here. This is pretty much a short description of what kind of call you had. Say we had a abdominal pain female patient. It was an ALS call. She's 41. You'll come in here and you'll type in 41-year-old patient with abdominal pain. And you can put 1 IV attempt if you're in that part of school, or vital signs, just short information about your patient. You'll come down here. All of your patient encounters will be competency. It'll automatically put you on formative, but you're going to have to change this to competency. And then you'll move on to your age group. It automatically inputs your age group based on what age you put in the years column. Over here, you'll have different team roles. Right now, it's putting me as a team lead, and you're going to want to click successful on everything that you do. If it's a successful encounter with a patient and you transport, you're going to want to click successful, and it'll come down here under skills pathologies performed. So you have a green check mark by your successful adult patient. If you encounter this patient and you do not transport, this is an attempted patient encounter. So for all intents and purposes, we're going to leave it as successful for right now. So like I said, your exposure is going to be competency, and your pathology is going to be related to your initial chief complaint. So our pathology, say she was having abdominal pain, well, this was secondary to having a rollover MVC. So that's going to be a trauma pathology. And you're going to want to click successful if your patient was transported. This down here under skills is where you're going to put everything that you have done. So if you administered a medication, you'll want to click that and you'll click successful. Or if you are doing, your basic rides and your preceptor administered a medication that's out of your scope of practice, but you were there, you can click that you observed an IV bolus medication that was given. The only thing that's required on every single patient is this EMS Patient Care Report 2021. If you do not have this, you will not be able to submit your overall clinical at the end of the day. So this is very important to have on here. After that, you can still see all of your skills, pacing, cardioversion, positive pressure, CPR, all that good stuff. Just make sure that you have your patient care report. So once you have that, you'll come down here and click save, and your patient will show up. And it'll say information has been saved. This is patient number 1 of the shift. And if you want to keep adding patients, that's fine. Say you have 10 patients that shift, that's fine. You'll just keep adding them the exact same way we added this patient. On your next tab down is a forms tab. On this forms tab is where you'll have your preceptor evaluation and where you will find your patient care reports that I said previously were required under the skills. So your preceptor evaluation is pretty self-explanatory. You have your 1 to 5 categories and your comments on your preceptor. Be honest. Put what you feel you need to put. We'll be able to see all of these submitted and turn them over when the time comes. So after that, you will come down to your patient care report. Each patient will be listed at the top. Like, this was patient number 1, but we remember that it's the 41-year-old female with abdominal pain. So you'll know which patient goes with which form. And obviously, like I said, you had your short narrative that you had earlier in order to help you remember which patient this was. So once you get to this section, you will want to fill out the form. This is a genuine run report. So this is going to be like a PCR that you would do once you're employed with an EMS service. Everybody has to do PCRs. You should do some PCRs during class as well to get you familiar with writing narratives. This is what this is. So once you start your clinicals and you start putting in patients, you will have to fill out a PCR or a patient care report for every single patient. So for all intents and purposes, we're going to say this was incident number 1. Your time of interaction, say you were with your patient for an hour. And everything else is pretty much self-explanatory. You just really have to read every single category on here. So you have your sex and your chief complaint, so female with abdominal pain. And what was it dispatched as? Was it dispatched as an abdominal pain, or was it dispatched as a traffic incident or an MVC? Then you're going to choose your level of service. Are you ALS or are you BLS? Was your patient transported? And how many patients did you have? Like I said, everything's pretty much self-explanatory. Was this a mass casualty? Yes or no? And then here we go again. Your patient age. You're going to list their medications, their allergies, pertinent medical history, injury present. Like I said, we're going to pretend this lady was a trauma patient. So yes, the injury was present and it was secondary to an MVC. And then the type of injury, it's very self-explanatory. So once you are going through all these, you're going to, like I said, read every ounce of these and fill in as much information as you humanly can. I understand that sometimes you're out on a clinical and you don't have all of the information because you're just the student and you're writing in the back and you can't hear the radio. It's not that serious. Just make sure you put in everything that you possibly can. Of course, while you're back in the back of the ambulance, you can say whether or not you responded lights and sirens, and whether you transported lights and sirens. Now your times. These need to be done to the best of your ability. When you are on your clinicals riding on the ambulance, you're going to keep up with your times in a little notebook or whatever is easier for you in your phone. However your instructor advises you do it, or however you feel is the best option for you. But you're going to keep up with all of these. And your prior aid, so that's going to be like, was the fire department's on scene and did they do CPR before you got there? Did they give any medications before you got there? Did they splint any extremities before you got there? This is prior aid. And you'll just type in everything that they did. Like, there's no categories to choose from in this section, so you're going to type everything. After you move on from the prior aid, you're going to go down to outcome. Was it improved? Was it unchanged? Worst? Unknown? Half the time it's going to be unknown because you really don't know the effects of anything until they're already at the hospital. Here's your trauma criterias. your adult triage, your pediatric triage, and then here we are with your symptoms. So like I said earlier, we had an abdominal pain patient, say she was complaining of weakness and pain, and then like I said, primary, associated, not applicable. Let's see. So then you go down to your provider impression. This is basically your initial impression of the patient and what you think is going on. So obviously the patient states she had abdominal pain. I can provide my impression that is the patient having abdominal pain. Yes. Does the patient have any of these other symptoms? Are they associated? Anything like that. Then you'll go down here to treatment, and each category will have what it is listed above it. So did you give medications? If you did, you need to type in your time, the medication you gave, the dose, the route, and the reaction. And you will type this all up by hand. There's no categories to choose from in here. Same thing, procedures. This is going to be your IVs, your intubations, your IOs, anything like that, your supraglottic airways. So say you did an iGel. What time did you do the iGel? So I did the iGel at 2000. There was one attempt. It was successful, and there was no complications. So after that, you'll input everything. So if you did an iGel, but you also started an IV, they both need to go in here. And then here goes your vital signs. So you should have 2 sets of vitals on every patient at the bare minimum. Obviously, your more critical patients, you're going to have multiple vital signs on that patient. And it tells you right down here, once again, you're going to input your time, and then pulse, BP, respirations, O2, GCS, any other pertinent vital signs for your call. Say you have a diabetic patient, you're obviously going to want to include a blood sugar here. Just make sure you have 2 sets of vital signs. And then advanced directive, if you know, then, feel free to put it, like I said, put as much information as you know. If you don't know if they have an advanced directive or not, that's totally fine. Your destination, you can put whatever hospital received your patient. These are not going to the state. So these do not have, you can put whatever information you feel the need in here. Aside from obvious patient information, such as their name, birthday, and social. You're not going to want to put this into these narratives. But you can put your destination and say it's Tanner Medical Center. That's your destination. Destination type, hospital, ED, OR, cath lab. Or if you transferred to air evac, or if your truck broke down and you had to give your patient to another EMS crew. These are all options right here. And then reason for choosing, most of the time it's going to be closest, and other times it might be protocol based on what service you're riding with. But if you're unsure, I would just put closest destination. And then this is where you will type your entire narrative. So this is going to be your chart or your SOAP method, whatever you choose to do, chronological, however your instructor advises that you write your narratives. This is where you will do it at, under this narrative tab. Once you have completed all of this, you will come down to the save option, and your attempt is successful and saved. And you'll be able to go back and look at all of the things that you inputted in, just like you would a regular PCR. And after you do that, you'll complete the other PCRs on all the other patients that you have put in for that shift. And then you'll move on to documents. So this is going to be strictly up to the instructor whether or not they require this. If you are on shift of a clinical and you are writing up paper PCRs, right here it gives you the option to select your files and place them in there as backup for all of the information that you're already putting in. Like I said, this is going to be completely up to your instructor. They'll specify what they actually want done in the end. After you have completed all of this, now you are at this Submit Documentation tab. Down here, this looks a little different because I've already been through an entire program, so my numbers are going to be completely outrageous. But right here, you're going to have like EMS field experience. You'll have your hours that you just obtained, and then your hours that have been completed and accepted by your preceptor and by your instructor. So, for instance, I've already done 204 hours when I was doing the paramedic program. And this would just add another 8 hours to my 204 hours. And like I said, I observed an IV bolus medication, so it did not affect my attempted or completed. And then you have your patient care reports. Like I said, I have close to 100 of them, but yours will look a little bit different. Other than that, this will show up so that you can track your progress as far as what is required from the state and from Platinum and from your instructor. You can track your progress and not have to go through your clinical notebook and count everything up individually. Once you put it in Platinum, Platinum counts it for you, so you really don't have to do anything after that. So after you've done all of this, if specified, a message can be sent to your instructor and preceptor. So this, you will probably never use this tab because you'll probably just go straight to your instructor and ask them questions once you get to that part, if you have questions. After all of this is complete and you have input every patient for the one shift that you have done, and what I mean by that is you have an 8-hour shift and you ran 12 calls in that 8-hour shift, you're going to have 12 patients listed in here. You're going to have 12 PCRs done and 1 preceptor evaluation. Once you have completed that, you will submit your documentation. Once you submit your documentation, it will completely disappear from your screen, and your instructor will be able to approve or deny your documentation. And when that happens, so this right here is our Ready to Document tab. This is the one we just started. Like I said, begin documentation, details, edit. If you happen to open a opportunity and you are not able to complete it all in one sitting, once you start an opportunity, you can leave the opportunity at any point and it will still appear and all of your information will be saved. But once you submit your opportunity, you cannot get it back. So submitted opportunities will go here. Once they're approved, they will come in here. And like I said, I've already done a ton of clinicals and a ton of these to show everybody how to use Platinum. They will be approved by your preceptor and your instructor, and this is where you'll be able to view your documentation afterwards. But like I said, if you are still documenting, do not submit it because you will not be able to get it back. And that is going to be how you document clinicals in Platinum.